We're proud as a state of California to have our own Surgeon General, but her expertise has been and continues to be trauma-informed care, a world expert in this space, and she's bringing that expertise to help address this moment so all of us can work through that fear and anxiety as we all are capable of doing with resiliency and the capacity to adapt to the moment as long as we have the support to get through this moment. With that, Dr. Burke Harris.
Thank you, Governor. The actions we're all taking to slow the spread of coronavirus, physical distancing, hand washing, wearing masks, and proper disinfecting are critically necessary and remain the top priority. But while we keep our physical distance, our social supports to maintain emotional and spiritual connection are more important than ever for our physical and mental health. The health impacts of coronavirus go beyond infection and COVID disease. It is important to recognize that stress related to the pandemic that many are feeling right now, compounded by the economic distress due to lost wages, employment, and financial assets, plus school closures and sustained physical distancing, can trigger the biological stress response, which also has an impact on our health and well-being. During times of heightened stress, our bodies make more stress hormones, including adrenaline and cortisol, and these can affect our health, our behaviors, and our emotions. Overactivity of the stress response can be associated with a variety of symptoms, some of which are familiar, and others that are less well known. Familiar symptoms include changes in sleep patterns or appetite, mood changes such as anxiety, depression, or anger, an increased risk of substance use or dependence, and family violence. However, health conditions such as headache, abdominal pain, and digestive difficulties, increased blood pressure or blood sugar, asthma exacerbations, and increased risk of infection are also associated with an overactive stress response. It's important to know that these changes aren't just in your head, and to begin to identify how stress shows up for you, physically, emotionally, and behaviorally. Individuals who have a history of trauma or adversity may also be at greater risk. The good news is that there are simple ways, simple things that you can do every day at home to protect your and your family's health. Safe, stable, and nurturing relationships help to protect our brains and bodies from the harmful effects of stress and adversity. Healthy nutrition, regular exercise, mindfulness like meditation, good sleep hygiene, and staying connected to our social supports and getting mental health care all help to decrease stress hormones and improve our health. We've brought together evidence-based guidance in the Surgeon General's playbook on stress relief during COVID-19 and an additional playbook for caregivers and kids that offers practical tools and tips that you can add to your daily routine. We've also developed guidance for health plans and healthcare providers on addressing stress-related health concerns during this pandemic, including how to implement trauma-informed care and supporting provider resilience. That information is available at acesaware.org. If you are concerned about the effects of stress on your health, call your doctor or your mental health professional. And if you need help finding resources, visit the Emotional Support and Wellbeing homepage at covid19.ca.gov. The thing that I would add is a recognition that a couple of things. Number one, there was unfortunately a terrible rumor circulating that for some reason African Americans don't get coronavirus. That rumor is completely false, and it's really important for all of us to get out there in debunking that rumor. One of the pieces that we also recognize is that because of the true and unfortunate history of medical maltreatment of different groups of people, but especially African Americans in the United States. There are real issues of trust between the African American community and the healthcare system. And that's why it's really important for all of us and all of our communities to distribute these messages through our trusted elders, through our trusted messengers within the communities, our faith communities, our pastors, whomever folks recognize can be trusted messengers, to make sure that folks truly are heeding the life-saving message that we need to stay home, save lives, and practice physical distancing. This is true in our communities of color, in our tribal communities, and other communities where we recognize that some of the messaging that's coming specifically from our public health infrastructure needs the help and support of our trusted messengers within our communities. Thank you.